Hello dear students, myself Dr. Maddineni Srinivas. The topic of discussion for this video is going to be neutrophilic dermatoses. So you might be wondering, sir, what are these neutrophilic dermatoses? The skin conditions in which we are going to see the presence of the neutrophils on histopathology. All these conditions are grouped together and we are going to refer them as neutrophilic dermatoses. So that is what is written here. So these are the heterogeneous but closely linked spectrum of disorders which are going to have the non-infectious sterile infiltrates of mature neutrophils. And you can see that clinically these conditions, we are going to hear so many new diseases related to dermatology. Maybe you are listening to them for the first time. Don't worry, we are going to again see each of them in varied videos in the future. Depending upon the topic of importance, we are going to discuss them in the future videos, right? So these conditions, they can present with urticarial plaques or they can present with vesicular pustular lesions or even ulceration and nodules. So these are all the possible morphologies of the diseases presentation. But remember, in all of them, the pathology is going to be the histopathology is going to be the same neutrophilic infiltration. And also not only that, even the therapeutic response is going to overlap, because in all of them the basic problem, the pathogenesis is almost the same, but the clinical presentation is going to vary. And remember, they are going to be various associated systemic conditions. Okay, so that's why these are all disorders which are going to require early diagnosis, and also close monitoring of the patients is very crucial, because so that we can diagnose the underlying systemic associated condition and we are going to also take care of that, right? So frequently associated with systemic disease, like for example IBD, there could be hematologic malignancies and there could be an associated connective tissue diseases. And not only that, there is also a possibility of genetic auto-inflammatory syndromes. So we are going to see each of them, and there could also be extracutaneous involvement. Not only the neutrophils are there in their skin, but these infiltrates can also be present in the organs also, like for example lungs, eyes, joints and kidneys, right? So depending upon the depth where are the neutrophils present, we are going to have the epidermal, dermal, subcutaneous and appendigeal variety of neutrophilic dermatoses. So remember, these disease names, you are going to just list out them. In the future videos, we are going to individually discuss each of these conditions depending upon the importance and significance of these conditions. Okay, so first one is, it is called as SCPD, in short, subcorneal pustular dermatosis. It's also called as Sneddon-Wilkinson's disease, right? And we have IgF emphagus, and we have this intraepidermal neutrophilic and subcorneal types which belong to this epidermal variety of neutrophilic dermatosis. So basically in this condition, neutrophils are going to be present predominantly in the epidermis. Amicrobial pustulosis of the folds, skin folds, infantile acropustulosis, transient neonatal pustular melanosis, TNPM, which is called as AGEP, acute generalized exanthematous pustulosis. And if the collection is there in the dermis, which is the classic variety, usually the neutrophilic dermatosis, the collection will be present in the dermis, right? So we have the sweet syndrome, which is acute febrile neutrophilic dermatosis, and also we have this PG, Pyoderma Gangrenosum, neutrophilic dermatosis of the dorsal hands, neutrophilic urticarial dermatosis, and rheumatoid neutrophilic dermatitis, right? And in the subcutaneous and appendigeal varieties, you can see there is neutrophilic eccrine hidradenitis, which is in short called as NEH, idiopathic palmoplantar hidradenitis in the children, neutrophilic sebaceous adenitis, and neutrophilic lobular septal paniculatus. And there could also be a possible overlap with the vasculitis when we have these erythema elevatum diutinum, and the granuloma facial Behçet's disease. And also there is one more classification based on systemic and syndromic associations, right? So if the individual is having a skin manifestations, then you can suspect the underlying possible systemic involvement and also underlying autoimmune connective tissue issue which is happening. So how? So if the patient is having this badass, what is this badass? This is not Vijay's movie. Leo song is there, badass. It's not that. It is bowel associated dermatosis arthritis syndrome. Okay, so then definitely it is bowel associated. So the underlying problem could be in the GI system. Not only that, pyostomatitis vegetans or Pyoderma vegetans, and also the Pyoderma gangrenosum patients, they could also be having associated underlying inflammatory bowel disease. Okay. Next is this condition PNGD, palisaded neutrophilic and granulomatous dermatitis, and also bullous and non-bullous neutrophilic dermatosis in the SLE patient. So definitely this is a connective tissue disorder associated group of skin conditions which are going to have the underlying problem of connective tissue disease or rheumatologic disease. And autoinflammatory syndromes, so there could be PAPA, so these full forms pyogenic arthritis, Pyoderma Gangrenosum, and acne. PASH or PAPASH, which is Pyoderma Gangrenosum, acne, hidradenitis suppurativa. Along with that, there could be also pyogenic arthritis. DIRA, which is deficiency of interleukin 1 receptor antagonist, right? And candle, chronic atypical neutrophilic dermatosis with lipodystrophy. Majeed syndrome, so there could be associated neutrophilic dermatosis, and along with that there is also a possibility of CRMO, chronic recurrent multifocal osteomyelitis and anemia in the patients. And we have various periodic fevers, like for example familial Mediterranean fever, hyper IgD syndrome, TRAPS, tumor necrosis factor associated periodic syndrome, and cryopyronopathies, like for example NOMAD, MWS, and FCS. We are going to see all these conditions in detail in individual videos, do not worry. Sappho syndrome, that is synovitis, acne, pustulosis, hyperostosis, and osteitis. And Schnitzler syndrome, that is neutrophilic urticaria along with monoclonal IgM gammopathy. Okay, so the differential diagnosis and disease overlap. So you need to also remember that there are other skin conditions which do not have anything to do with the neutrophilic dermatosis, but in which case the histopathology may look same like neutrophilic dermatosis. So what are those conditions? Like for example, the autoimmune bullous disorders. For example, dermatitis herpetiformis. I hope you remember in dermatitis herpetiformis, there is going to be a collection of the neutrophils in the papillary tips, which we call it as papillary tip microabscesses. Okay, so because this is a neutrophilic dermatosis, this is an important differential histopathologically, right? And also we have this linear IgA bullous dermatosis. Usually bullous pemphigoid histopath is going to be predominantly eosinophilic, but there could also be a variant in which neutrophils could be the predominant cells in the bullous pemphigoid. And also EBA, which is inflammatory variety, it could also have a predominantly neutrophilic infiltration. And in the infections, definitely there are going to be neutrophils which are seen in the cellulitis and erysipelas, so it is an important differential histopathologically. Septic vasculitis or emboli, and halogenodermas, iododermas, and bromodermas, and papillosquamous disorders like pustular psoriasis. So these are all the important histopathological differentials or mimics for neutrophilic dermatosis. So that's it, students, for this video. I hope this video was helpful. So please do that like button and also do subscribe to my YouTube channel if you have not yet subscribed. Do share this among your friends and do comment if you have any queries. I would like to answer your queries. We'll meet in the next video. Till then, happy learning. Sarvam Sri Krishna Arpanam, Sarve Jana Sukhino Bhavantu.